Wellness Wednesday, and although the warm weather is nice, it also means that tick season has officially begun. And Dr. Ken Stewart, KCU Assistant Professor of Primary Care, is here talking about the details and what we should look out for. Gosh, these are dangerous. This is not just a little bite. This can be life-threatening.
It can be life-threatening, that's true. Warm weather, wet weather, that brings the ticks out. And when the deer go, the ticks go. So, we have to think about when a tick bites you, they actually inject saliva, and they can inject parasites and viruses and bacteria.
Lovely.
Yes. Very unpleasant, very unpleasant.
Yes, it is. How do we avoid this? What's the best way to avoid it?
The best way to avoid is to put on some sort of protection, like DEET, some insect repellent. Also wearing tight-fitting clothing so the ticks can't crawl up, into your pant legs and things like that. And then, of course, trying to avoid, if possible, brushy, grassy fields and woody areas. That's the best way to avoid it.
Do we need to have DEET? And I always hear that if you don't have DEET in your repellent, that it's just not going to work, but it has some dangers to it as well.
Yeah, there are some side effects of DEET, but I would say the risks of getting a, tick bite and having a bad outcome, getting Rocky Mountain spotted fever or Lyme's disease, which Lyme's disease is the most common tick illness that we see in this area. And then there's anaplasmosis, and there's also ehrlichiosis.
Okay, I want to hear about each one of these. This anaplasmosis, you floored me with that one. Explain that one to them.
So that's usually passed on by the black-legged tick. And that can cause symptoms like the flu. So body aches, fever, chills, kind of feels like you got the flu. It can also cause GI side effects, so nausea, vomiting, decreased appetite.
Now, what's the one where it makes you so allergic to meat?
Okay, you're talking about the alpha-gal syndrome.
Oh, this is insane.
This is a bad one, yeah. This is one that alpha-gal is actually alpha glucose. It's basically a sugar. And what it does is it's found inside meat and dairy products. If you get this alpha-gal syndrome, you can have a full-blown anaphylactic reaction with lip swelling, tongue swelling, difficulty breathing, breakout in full-blown hives, and you cannot eat red meat after that, and there's no treatment for it.
And you can just be in a restaurant, you said, where there's red meat, and you can get sick.
Yes, even dairy products too.
Wow.
Yeah. So if somebody's cooking meat, red meats, you can walk in. If you've got alpha-gal syndrome, that's a really bad one to get.
And Lyme's disease, that's one of the most common, isn't it?
It is. Lyme's disease is known for its classic rash. So it's called a bullseye rash or target rash, where you have usually a little red area in the center, there's an area of clearing, and then there's another red ring. So it actually looks like a bullseye or a target.
So say we find a tick on us, what do we do?
Yeah, as soon as you find a tick, you want to remove it as quickly as possible. If the tick has been on less than 36 to 48 hours, usually that's the time frame that it takes for the bacteria to get into your bloodstream and create a problem. If it's on less than that, you got a pretty good chance it won't be a problem. Pull the tick straight off, cleanse the area with antiseptic soap and warm water, and keep it as clean and as clean as possible.
And if you start feeling bad or notice any redness, get to the doctor.
Yeah, get to the doctor, because there are antibiotics that can be used to treat the bacterial infections like Rocky Mountain spotted fever and ehrlichiosis and Lyme's disease.
You've got to get on it as soon as possible.
Yes,
right?
the best thing, Shelby, is prevention. You want to make sure that you're using those precautions. When you go outdoors, just make sure you've got the tight-fitting clothing. Make sure that you take a shower as soon as you get home. Have somebody check you over. Ticks are notorious for finding these little folds in your skin, like your elbows, underneath your armpits, up in your groin. All those kind of hidden areas. In your socks, yeah, around your neck, even in your hair. So make sure you look real closely. They can drop out of the trees.
Oh my goodness.
Yeah.
I'm done with the woods now after this. I love the outdoors, but you've got me afraid of it now. I don't want any of that. Thanks so much,
You're
Doctor.
welcome. My pleasure.
We always appreciate all your advice.